My name is Marjut Otala, and I'm the president of the Nordic Fertility Society. The Nordic Fertility Society is an umbrella organization for all Nordic countries. The Nordic countries that make up the Nordic Fertility Society are the three Scandinavian countries Denmark, Norway, and Sweden, together with Finland and Iceland. Members of the national fertility societies of each of these countries are also members of the Nordic Fertility Society. The Nordic countries are not only a geographical and cultural region in Northern Europe and North Atlantic, but they also have much in common in their way of life, history, and social structures. In addition to the sovereign states of Sweden, Norway, Denmark, Finland, and Iceland, there are autonomous territories included in the region, such as Faroe Islands, Greenland, and the autonomous region of Åland. The population in Norway, Finland, and Denmark is around 5.5 to 6 million in each, in Sweden around 10 million, and in Iceland there are approximately 350,000 inhabitants. As we are a group of small countries, the slogan of the Nordic Fertility Society, "Together we are stronger," is very true. Nordic cooperation in assisted reproduction goes back to the beginnings of IVF, as a few pioneering colleagues from Denmark, Norway, and Sweden met in Denmark already in 1982. Since then, IVF professionals from all Nordic countries have met regularly in official Nordic meetings. In 1995, an interim board constructed bylaws for General Assembly at the Nordic Conference held in northern Finland in 1999. NFS represents all professional groups involved in assisted reproduction. This includes medical doctors, embryologists, biologists, laboratory technicians, nurses, psychologists, secretaries, and assistants. Fertility treatments are offered in the Nordics both in public hospitals as well as in private clinics. Each country has several reproductive medicine units and many fertility clinics, except for Iceland, that only has one. The proportion of babies conceived using ART is relatively high in the Nordics, ranging from around 4% in Norway to a bit more than 10% in Denmark. Denmark is the world record holder for births by artificial reproductive technology. Interestingly, in Denmark, fertility industry is one of its most successful exports, and the country is also home to the world's biggest sperm bank. A significant reason behind the high rates of ART-conceived children in the Nordics is that the countries have a public healthcare system that is paying for the treatments. The so-called Nordic system is that everyone is willing to pay high taxes, but everyone is benefiting from it also. In all the Nordic countries, infertility treatments are to some extent paid by the public health services, although in Iceland and Norway, the user charges for in vitro fertilization treatments are higher than for other types of treatments. Along with generous state funding comes state control of access to IVF. ART is regulated by law in all Nordic countries, and there are national registries of ART activity. It is required that healthcare professionals must evaluate those seeking for ART to be fit parents before they are approved. Usually women over 40 don't get state-funded treatment, and those over 45 or 46 may also be barred from accessing IVF privately. There may be long waiting times to receive state-funded treatments, and it may not be available for all patient groups. There could also be a deficiency of donated cells, which may increase the waiting time. In all Nordic countries, insemination with donor semen is allowed not only for heterosexual couples, but also for female couples and single women. Treatment with donated sperm is also allowed to all patient groups. egg donation is prohibited for male couples, and surrogacy is not allowed. The legislation varies between the countries whether egg donation is allowed for female couples or for single women. Double donation, meaning donation of both the egg and the sperm, and embryo donation is also prohibited in some countries. Key elements in the regulation of pre-implantation testing for monogenic disorders and structural rearrangements are similar in the Nordic countries, although accessibility varies since only Denmark, Finland, and Sweden have national clinics offering treatment. In addition, Denmark and Finland have private clinics offering PGT. Regulation is the most stringent in Norway, where a national board evaluates all couples seeking treatment. PGT-A is allowed in Finland and Iceland as a treatment itself. Denmark and Sweden offer it only in the form of a research protocol, and Norway does not allow it. The clear challenge to the Nordic region currently is the declining fertility rate. In recent years, fertility rates have decreased in all Nordic countries. Only in Faroe Islands and Greenland, the total fertility rate is high enough to fulfill the replacement level, which is 2.1 children per woman. The fertility decline has been ongoing for a few decades now. Fertility is strongly declining in Iceland, Norway, and Finland, and less sharply or stabilizing in Denmark and Sweden. The fertility rate for Finland is already as low as 1.46 for 2021. Fertility decline is not uncommon in these countries, but previous strong decline has been the consequence of fertility postponement and recuperation at older ages, which has counterbalanced postponement. This time, the decline is not only postponement, but also a decline in completed family size. One of the key drivers of the decline seems to be that more women remain childless. The Nordic countries have thus far been able to combine relatively high fertility levels with high female labor market participation rates. The Nordic countries have often been seen as forerunners in fertility behavior. However, fertility is declining strongly despite the work family-friendly environment and high levels of gender equality. And the reasons behind the decline remain unclear. The aim of the Nordic Fertility Society is to work effectively for an increased basic understanding in reproductive medicine and improved clinical treatment for male and female patients. NFS has held biannual conferences and yearly educational courses for its members. The European Society for Human Reproduction and Embryology, ESHRE, offers certification programs for its members and that aim to certify competence and to develop a formal recognition for our professionals. The Nordic Fertility Society has offered its members free of charge preparation courses for those preparing to take these certification examinations. The courses are also of benefit to professionals who would like to refresh and update their knowledge in the field of reproductive medicine and embryology. The COVID pandemic required NFS to find ways to overcome the restrictions for on-site meetings, as sharing of knowledge and expertise are the core of the Nordic Fertility Society's work. Continuing our activities online has become essential. The NFS has arranged a cutting-edge webinar series with the Baltic Fertility Society, and this fall we collaborated with the New England Fertility Society from the United States in a unique and exciting session where we had an opportunity to learn from each other and exchange ideas between the two societies. As all Nordic countries struggle with the low birth rates, the Nordic Fertility Society has expressed its strong support to the initiatives in fertility awareness and reproductive sustainability by approaching the governments of each country regarding these topics. We aim to continue the important work for the benefit of our patients and the professionals in the field of reproductive medicine. Thank you for your attention.